Hello class and welcome to week 7. As you start to think about your proposals for your grant writing assignments, we continue to learn and focus on vulnerable populations and what are the health issues that vulnerable populations are facing right here in the U.S. In Module 4, the course objectives are around healthcare in the 21st century. How are we as a healthcare organization or a system preparing to meet the demands of healthcare in the future? Moving to a healthier community, leading the vulnerable populations to a better state of health. One thing is that, we work on increasing access to care by using a lot of different strategic methods, including technological advances in informatics and healthcare redesign. The World Health Organization identifies the use of informatics and health information technology systems, which includes telehealth, telemonitoring, telecommunications, electronic messaging, the EMR, as a way to treat a condition or illness, and also to use as a health surveillance tool. And what are the other issues that vulnerable populations face? Well, we know that that includes substance abuse. We know that that includes domestic and social violence, communicable diseases, mental health, and there's an increase in chronic disease management and comorbid conditions. And also, as we've learned over the last several weeks, how does one's environment impact their state of health? How does it impact those that we're trying to lead to a state of prevention and wellness? Managing chronic conditions, and also self-management of their own care. How do we as nurses prepare these vulnerable populations to get to that optimal state of health? Bonser Course has a strategic quality plan. It's called the SQP. And the goals of Bonser Course includes co-creating, so working collaboratively to build healthy communities. We also strive to be person-centric. The patient is the center of their care and their self-management, working with their provider, their primary care physician, and other members of the healthcare team to develop individualized healthcare plans, increasing engagement and focusing on prevention and wellness. Also, serving vulnerable populations, addressing health disparities, and strengthening our culture and capabilities. When you write your grant proposals, think about your community. Think about what's around you, your populations that are around you. Be strategic and innovative in your thoughts. And think back to your nursing process. Assess your community. Identify the problem, and this will help you create your problem statement. Also, planning. What are your goals? Are they measurable? Are they realistic? Are you selecting goals that are meaningful to you for this project, this proposal? And what timeline are you looking to accomplish these goals? Also, do you have evidence-based supporting evidence for your proposals? Have you done your research? Have you looked into literature reviews? And also, how will you implement those goals? And what processes will you use to measure your goals? Under Module 4, you have a Nurses for Good PowerPoint. You have the Nurses for Good application and a grading rubric that will help you and be a guide and resource to you as you work on your grant proposal. I want you all to keep in mind that during these proposals and discussions, I'm going to be looking at the quality of your work. I want to be able to read your proposals and your thoughts and feel how much this project means to you, how much you think that this project will make a difference. I want to be empowered and inspired reading your proposals. I also want to remind you all that please to look at the course calendar for your assignment due dates. And if you're running into any problems or experiencing any difficulties, please reach out to me as soon as possible so we can talk about what's going on and what can we do to get your assignments done. Again, I am here to serve you. Thank you all, and I hope you have a great week.